ready here in Bohol. Everybody's arrived. We've bought all the bags, that all the contributions and all the fundraising is provided. That way we can bring all of our supplies with us. We're coming into a very bare bones operating theater, so we have to bring everything we need with us. All the team members have been loading bags and carrying them upstairs and getting them all organized. All the kids are ready to come see us tomorrow. We're gonna set up our clinic and make sure we have all our surgeries planned for the week ahead. Everybody's really tired, but we're gonna spend the next couple hours making sure everything is in tip-top condition. That way we can see as many kids as possible tomorrow and make things as safe and effective as possible. To make this mission happen, we need sutures, we need operating trays, we need suction equipment, we need anesthesia equipment in terms of laryngoscopes, in terms of endotracheal tubes. We need all the administrative supplies. We need all of our post-operative supplies, our medications for pre-operative and post-operative anesthesia. We need all the pain medications for the children. Not to mention, we have to bring all of our own blankets and linens. The hospital doesn't even have the resources here to provide those for us. All of the equipment we bring, all the supplies that we have to organize to make this mission a success, they come from the fundraising that FOT does throughout the year. And without that fundraising, none of this would be possible.
So we're seeing patients today. We've seen almost 11, 12 patients now. It's 9 o'clock in the morning. Probably started about 30, 45 minutes ago. So that's a really good start. There's a lot of patients out waiting. So far so good. Our screening area. The patients are coming into the admin section of the screening clinic. They're taking photos. We're screening patients, trying to do it as fast as we can because we know a lot of the families have come from potentially 3-4 hours away and they're not going to eat all day, and trying to also provide some snacks and water for them. But we're trying to see everybody and figure out who's going to get surgery, who's a candidate. We have our dentist see the patients with us. We have our speech pathologist, our anesthesiologist and pediatrician who's screening the patients, and we're just trying to see what we can do and see how many patients we can help this week.
We're on our first day here, and we did a lot of work yesterday to get ready for being here. We brought 28 bags, and these are not little bags. These are the biggest duffel bags you can imagine, all full of gear to come here to bring all the supplies, because when we come to the Philippines, they really do not have any supplies that we can use. For example, we bring all our suture, all our instruments, all our scrubs, all the medications, all the things we're going to need to run an operating room for a week. Yesterday was a very hard work day for us. We had people divided into two main areas. One area was screening patients, and the other area was up in the OR working all day to get things set up. We had to take 3 operating tables and completely equip those tables with sutures and all the supplies and saline, etc., and organize everything in a way that we can run an OR when we're here. Just like we have at home, only at home we have ORs that are set up for years at a time and everything's all prearranged. Here we have to set up exactly what we're going to do. So here's a perfect example of how things are different here in the Philippines. Here we have an OR that's equivalent in size, or actually a little smaller than a normal OR in the US. And do we have one operating table in here? No, we have 2. There's 2 patients being worked on foot to foot in this small little space. But with that space, we can help 2 patients at a time. Today is our first day, and the first days are always a little bit slower as you get the kinks worked out. So today we're operating on 10 patients over the 3 tables. Many of the patients are having more than one procedure, such as they may have a cleft lip revision and then have their palate repaired, or a variety of different things. Right now we have 2 tables working with a team of 2 surgeons and two nursing people helping them work at both those tables. Yesterday we screened lots of patients to come up with 54 patients that we're going to perform surgery on. On those 54 patients, we're going to perform 75 procedures, which would include cleft lip repairs combined with the cleft palate repair or some other procedure to help their speech. And on top of that, probably half those patients are going to have dental procedures. On many of the procedures we performed today, we spent over a half hour removing infected abscessed teeth before we could do our work. But we know it's important to do that because these patients have no access to care.
So our schedule is incredibly full. The team is working until 10 o'clock at night, and 2 kids just came in, traveled 3 hours from Obai, which is on the other side of Bohol, and one is 16, one is 19, never had surgery before. The 16-year-old, the dad said he stopped going to school because of his lip and he gets teased. The 19-year-old finished school, but it just has never had surgery. So when I went out there, I was prepared almost to say that we're full, but after talking to them, how can you say no? There's no way we have to do something. It's what are we gonna do?
Rodell? You're 16 years old, is that right? And what is your name? Edward. Okay, and you're 19 years old, is that right?
Did you tell him that we're gonna be able to do a surgery?
Until ugma sa aga kay
Okay?
Okay?
Good?
He stopped schooling because of his condition here. Because some of his classmates tease him about that.
Do you think he would go back to school if we fix the lip?
Yeah, after the surgery, he will.
The fact that you can just do one surgery and then change his life, and then he's going to go back to school, and that really can change his life. He can go back to school, hopefully get a job, not be so ashamed. So we can't say no. It's impossible. And our nurses have already stepped up and said, "Oh, we'll stay late, no problem. We'll stay late on Friday." So that's why you come. That's why we keep coming back.
Yesterday was her intake day, and we had a patient come in today. She was abandoned at birth due to her cleft, and the person that's taking care of her is her aunt and her first cousin. She doesn't have a birth certificate because she has no medical records, so she can't go to school because of her cleft, and she's just an adorable little girl. So we're gonna go talk to her first cousin.
Her mother is my friend, my aunt, but my friend too. Then when she's born, I think they don't want that his condition, and then they left the baby in their house in the in the city, and then they go because they're addict. They're using drugs, and then they just left this baby, and then she can't go to school because she has no birth certificates and many papers, and we're just helping her.
So I went in and talked to Kristen, and she mentioned that the surgeons, they're in surgery right now working on other patients, but they're going to come out and talk to the family to see if they can change Diana Rose's life forever.
Are you excited?
Yeah, very much.
You ready? You ready?
So what do you think?
That's good. She's beautiful now. I'm happy.
Diana Rose is now just released from the hospital, and now we are bringing her home to their house.
She looks very pretty, amazing, and gorgeous. And all is happening in very quick time. Like a magic.
We're about to go now to Diana's house. For sure, the family members now are all very excited. These are all her family members, her cousins. They said that her face changed a lot, and it's very amazing, and they're very happy about the result of her surgery. Diana Rose used to sleep here on the floor, or sometimes she used to sleep also on the on that room, and also the other members, since they have only 2 rooms and they're big family, so they have to stick together. As what the family said, it's really like a magic for them.
Save your faces of tomorrow.